Thank you for watching this video training from www.intouchemr.com, the fast, integrated, and easy EMR. Visit our website for a demo and a free executive briefing on the 5 blunders to avoid with EMR.
Hey everybody, this is Nitin Choda with www.intouchemr.com. In this video, I'm going to talk to you about one of the biggest problems I find. In fact, I'll be honest, it frustrates me. One of the biggest problems I find with most EMR systems. I call it the problem of documentation overkill. Now here's what documentation overkill means. You're a physical therapist, you get an EMR system, you spend a lot of money for it, you log in, you look at documentation templates, and the templates are long. They are long. Now the logic of the EMR company or the logic of the people who sell you this is, well, it needs to be comprehensive. Of course documentation needs to be comprehensive, but it doesn't need to be overkill. The problem with most documentation systems is that the documentation is overkill. This is a big problem because the physical therapist, who is the most important component of the practice, because it's your time as a physical therapist. And by the way, I'm a licensed physical therapist myself, and so is my wife. So we know where you come from, because we've been there, we are there. A physical therapist making documentation overcomplicated puts too much pressure on the physical therapist. Too much. It shouldn't be that way. The physical therapist, instead of being someone who's looking after the patient, managing the practice, trying to be a business owner and trying to be a clinician and document at the same time, the clinician now becomes a data entry expert. And I know I'm going to have a lot of people out there that may not agree, but I'm sure you know what I mean at some level. You don't want to be a documentation, you don't want to be a data entry expert. You want to document enough so that you're compliant, but you don't want to overdo it so that you're constantly doing your notes. Because what's important is an integrated system that lets you schedule, that lets you document your way. I've done another video training within the same channel on flexibility in the documentation process, so you may want to check that out. But the physical therapist should not become a data entry machine. The physical therapist should be able to document in a simple and effective manner, generate your own templates. It does take a little bit of time to set up your own templates, but it's worth the effort because you're documenting your way instead of being forced to document and being forced to change your workflow. Shouldn't have to do that. The right system should adapt to you. You shouldn't have to adapt to another system. Let me repeat that. The right system should adapt to you, not force you to adapt to it. So I strongly recommend that you get a system like intouchemr.com that allows you to document your way, that gives you flexibility in the documentation process, and that prevents documentation overload and an overkill where the physical therapist becomes a data entry expert. Thank you so much for watching. Just for watching, I'd like to send you a free report on the 5 blunders of the 5 blunders associated with physical therapy EMR systems. Just go to intouchemr.com and request that report. We'll send it over to you, and that report will help you significantly whether you choose to get InTouch EMR or not. Thank you so much for watching, and I hope you don't become a victim to documentation overkill. Thanks.
Thank you for watching this video training from www.intouchemr.com, the fast, integrated, and easy EMR. Visit our website for a demo and a free executive briefing on the 5 blunders to avoid with EMR.